Hi, I'm Dr. Brian Kim, medical retinal specialist at Harvard Eye Associates, and I'd like to talk to you a little bit about flashes and floaters today. So, when we get flashes and floaters, sometimes we'll suddenly see tiny little specks or little shadows floating in our vision, or quick lightning bolt flashes of light, often on the side of our vision. And these are always symptoms that we want to investigate a little bit further. Not emergently, but a little bit urgently. And I usually like to tell people within about 2 days, within about 48 hours, we do want to see you and look at your eye, and specifically your retina, for a dilated eye examination. Now, when we're born, our eye is filled with this gel. It's called the vitreous gel, and it's 100% solid like jello. When we're 100 years old, you can think of it as turning into 100% liquid. So as we get older, the gel inside of the eye starts to naturally liquefy and slosh around with time. Now, the problem is that this bag of vitreous is velcroed to the inside wall of the eye, to the retina itself. So as it starts to slosh around, it's naturally going to unvelcro, and the whole bag is then going to freely float inside of the eye. And we actually want that to happen. We've been trying to do that with medications for decades. We just have not been successful at doing that. But once we do that, once the vitreous gel separates, then theoretically our risk of retinal detachments or retinal tears goes to zero. We just have to get you to that point safely. And there's unfortunately no way that we can do this over the telephone. There's no way that you can tell us what your symptoms are and let you know that you're okay. We just have to look at you and see exactly what's going on. The floaters themselves come from the gel moving around. So you might see that, and they can linger and they can be kind of annoying for some people, but they usually last for several weeks, sometimes several months, or even years. But in general, they start off initially as the worst that they're ever going to be, and usually most often they taper off, and over time they become less and less noticeable as your brain learns to ignore them and as gravity starts to settle them down out of your vision. The flashes are a little bit more concerning if you're starting to see new flashes. The flashes are quick arcs of light, often on the side of our vision, and that's usually an indicator that your retina is actively being pulled on, or traction on the retina. Now, if the vitreous pulls too hard, it can actually pull off the retina itself, and that's something we call a retinal detachment. If we catch it in the first few couple of days, oftentimes we can catch it when it's just a small flat tear, kind of like a tear in wallpaper. If we can catch it when it's small, we can usually treat you in the office, and we usually have a very good outcome or good prognosis. If we ignore it, however, and we don't catch it, then it can sometimes continue and progress, and the retina can be pulled off completely. That is something that we call a retinal detachment. A little bit more challenging to fix, depending on the case and depending on the person. Every case is different, but the bottom line is we want to see you sooner rather than later. Again, not emergent, but urgently. For that, give us a call, let us know your symptoms, and we can usually get you an appointment right away.